Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. Today's guest, Dr. Michelle Maddux, absolutely shared some tremendous insight into what it means to be a naturopath and how to truly excel as a naturopath. She also speaks about genetic tests, why they're so important, why they are a critical baseline for doctors to use, and truly a test that most consumers want to take. Hello, everyone. Dr. Rob Silverman, host of Proven Health Alternatives. I've got Dr. Michelle Maddux. How are you, Doc?
Hi, good morning, Dr. Rob. How are you doing?
I'm doing great. I'm excited to have you here. I know we're going to have this great little give and take. We've chatted multiple times, and we're going to talk a lot about various topics. We're going to talk about your background. We're going to get to genetic testing and why and which genetic tests to do, and some other things that you individually are doing on your pipeline. So, you are a naturopath.
Yes.
What
Yes.
What's a naturopathic doctor?
So a naturopathic doctor is a primary care physician. We just have slightly different things in our tool belt, right? So we do all of the didactic, we do the pharmacology, we do all of the stuff that a traditional MD would do. However, we also learn botanical medicine. We do a lot of nutrition and nutritional biochemistry. And we learn physical medicine. The school that I went to also included traditional Chinese medicine, so pulse diagnosis and Chinese herbs and acupuncture.
Interesting. So the naturopath is sort of a cross between a chiropractor and an MD, but you emphasize more herbs, if you will.
For me, I always look at it as it's the middle path. And,
Uh-huh.
and for me, things that are the middle path are always really appealing. So it's not super duper, traditional Western medicine, but it's also not way over in the, alternative and medicine that sometimes makes people go, really? I don't trust that. It really does walk that middle path where we draw from all different disciplines to find the best of what works for the patient who's sitting in front of us.
So you use a lot of herbs, you'll use minerals, you do, as you said, physical exam. You're big in acupuncture, and you can do some manual therapy, manual manipulation if and when needed.
Yes, most of us, unless that was their subspecialty, most of us still very much prefer to chiropractors because what we get isn't nearly what chiropractors get. And I personally am a big fan of grow your network and know what you know and know what you don't know. So refer to the best possible person. We also do a ton of nutrition because we get so much nutritional biochem. So it's knowing that targeted nutrient or the targeted dietary intervention or something along those lines.
Interesting. Having dealt with and lectured with and to so many naturopathic doctors, they are, I like what you said, they are your natural primary care physician. And the ones I've dealt with are so knowledgeable on blood labs and look for more extensive type of blood labs.
Yeah.
So what would your blood lab look like in pages? Like, for instance, the average MD, not a knock, probably 4 pages. How big is yours?
Well, that depends on if I get to run everything I want to run and if it's limited by insurance or not, and not limited to a blood panel. In a perfect world, I would get CBC, CMP, organic acids, I would get essential fatty acids, I would get genetic testing. I mean, in a perfect world, I would have a good booklet on everybody that I would then be able to tease apart. How are we going to help this person? Perfect world doesn't happen a ton, but yes, a booklet, that's what I would get.
So I guess I segued inadvertently, and so did you, into testing.
Yeah.
So let's talk about testing. We'll take it piece by piece. You mentioned blood testing.
Mhm.
So as everybody knows, blood testing is a snapshot at a particular time. Talk about some of the blood tests, and then you can go to organic tests, you can go to some of the stool tests, and we'd love to highlight some of the genetic tests at some point.
Yeah. I go with the traditional clinicians in that I think that a basic CBC CMP is a necessity for everybody at least once a year. It gives you that snapshot, and all blood tests are snapshots in time, and we recognize that they change, but at least it gives you this high level overview of stuff to track. From additional serum phenotypic testing, looking at essential and metabolic fatty acids, looking at amino acids, looking at doing a more in-depth thyroid panel on most patients is very good, especially hitting that reverse T3. Looking at some of the more in-depth iron studies, depending upon who you're working with. Those to me are basics, and they're equally important as a CBC CMPs.
Outstanding. So just to be fair, and you are I have it here, you're the director of product for Toolbox Genomics and the founder of Soaring Phoenix, a consulting firm dedicated to educating clinicians on the fundamentals of integrative and functional medicine. Everybody knows that I use Toolbox. I have Toolbox Genomics. It's right here. It's on my website. So full disclosure, great item. Love it very much. Why don't you talk a little bit about this? But first, I would suggest, I'm going to ask you some rapid fire questions so everybody knows. Okay. What's genetic testing?
Genetic testing is looking at a patient's DNA. Doesn't change. You get one from mom, dad. They come together, and we specifically, Toolbox Genomics is looking at SNPs, which are to assess risk and predilection for disease.
So you've got SNPs, traits.
Yeah, Toolbox sorts those SNPs into traits, which are typically signs and symptoms or a condition. And then we box those traits into panels, which tend to go along into the systems biology approach, so that you can see very quickly, without going into the weeds of an individual SNP, you can see very quickly, what's my patient's predisposition for a low vitamin D? What's my patient's predisposition for developing type 2 diabetes, for example?
Great stuff, because like you said, a predisposition or a probability, if we can use that word. So there are people that have high probabilities, moderate, and low probabilities. And that highest probability, my understanding, I think you could say, is about 90% accurate.
Well, from a genetic perspective, the testing is 98.7 to 99.9% accurate, to throw some numbers out there. However, as everybody says, your genes are not your destiny. They're that groundwork. And then we layer in the epigenetics and how do you live your life and what are your additional family histories and exposures to then come to what's your proposed outcome. Genetics lay the foundation, but they're not where the story ends.
That's great. So it is a conversation piece. You and I both were at Integrative Health Symposium. We met a lot of great practitioners. It was a conversation piece. So we said what genetics was. I want to come back to the testing. What's the genome?
What's the genome? It's the whole thing. So genetic, you're looking at a single individual genetic, and the genome is like, the genome-wide study, which you're looking at the entire genome of the human that you're looking at. So that particular person's whole genome.
Epigenetics. You used the term.
Yeah, epigenetics. So, your genes don't change, right? You have those for your life. However, especially when we're talking about SNPs, most SNPs regulate an enzyme in the body. And we all know that enzymes are what push and pull every process in our body. Epigenetics layer on top of the genetics, and they are really the things that tell us, is this SNP going to be expressed, or is this SNP something that's interesting? However, because of how this person lives their life, it doesn't have an impact because it's not being expressed. There's no impact from this SNP from an epigenetic standpoint.
Outstanding. So 23andMe is very popular. We all know it.
Yeah, yeah.
So how would Toolbox differ, if you would, from 23andMe?
So 23andMe is a consumer-facing product. It is predominantly direct to consumer. And so a lot of the conclusions that they draw and things that they say are couched, right? The FDA regulates that very, very heavily. Toolbox Genomics targets predominantly practitioners and clinicians, so we can go into a little bit more depth with the research that we do, the conclusions that we draw, and how we advise those practitioners to work with their patients. The other piece that is, to me, a very important piece is our particular tests are significantly more in depth, and they cover a larger number of SNPs. So we are less likely to raise a red flag based on a couple of SNPs, because that's just not how our tests work. We pull in hundreds of SNPs, and then we say, you do or you don't have an increased risk for this particular disease, and here's what you do, which would be the last part and the biggest, another reason that we're so much different than 23andMe, we give that so why do you care? Genetic testing should not be just an intellectual exercise. It should be very focused on, okay, here's the findings and what do I do about it? How do I use that particular piece of information to change risk predilection or something along those lines?
Yeah, so we're both practitioners, and I really like that idea of the risk predilection because that's a baseline. So that's why practitioners should carry it and people should get it. Genes are for a lifetime.
Yeah.
So I did mine, and there were some things that were quite revealing and evocative to me.
Yeah.
Looking down and realizing that I have a high probability of lactose intolerance, not knowing that, but I'm gluten and dairy free. Everybody knows that. I talk about it. Many people have walked out because I've asked them to go gluten and dairy free. I can tell you that I've been eviscerated a few times in the Midwest when I said no dairy, all that kind of stuff. But these are baselines for, health and individualized and personalized outcome. So you've got a Toolbox 14 different kits. When I say kits, 14 different panels, I think would be a better word.
Yeah, we have 12 to 13 different panels, and then the practitioner can mix and match all of the traits to create a panel that works based on their patient population or their client population.
And it's just a cheek swab.
Yeah, just a typical swab. No spitting in a tube, no drawing blood, and because it's just a cheek swab, you can do it on infants all the way through, obviously, your geriatric population. It's really easy to collect.
Interesting. So with all that, why'd you pick being a naturopath? I mean, you had chiropractic, you had MD, you had nurse practitioner. You had choices.
I did, and I actually explored. I almost went to chiropractic school in the Midwest. I pulled out of that.
In my head, don't do.
Huh?
I'm just trying to be funny.
And I almost went to medical school to be a psychiatrist, and they just weren't quite the right fit for me. I always knew I wanted to be a doctor, and I wanted to be a doctor that pulled in how people eat and how they talk to themselves and how they're doing psychologically and their relationships and vitamins and nutrients. I grew up going to doctors in the back of health food stores who looked at my nails and told me what I was lacking in. That's just how I was raised. So I knew I wanted to pull all of those things in. And when someone told me that that was a naturopath, I went, I've never heard of that, and researched, and that's where I landed. It was exactly what I wanted to be without knowing that it even existed.
Wow. That's great. It's funny, as a chiro and a naturopath, I'll say alternative to medical doctors, we've always been touched by somebody, and that impression has led us down the line. I always tease everybody that nobody becomes a brain surgeon because they have brain surgery. Typically, you don't become a police officer because you had an encounter with a police officer. But for us, naturopaths, chiropractors, possibly acupuncturists, that's really very true. So you do a lot of genetic testing. You work with Toolbox. You do a great job. What other things are you involved in? What's driving you now? What's hot?
What's hot? So, the things that I'm passionate about, one of my specialties is adolescent medicine. And I love adolescent medicine because it feeds into stopping complex chronic disease, right? You get to an adolescent before they've developed type 2 diabetes, before they are obese, before they have hormone irregularities. And now, instead of reversing complex chronic disease, they just didn't develop it in the first place. So that for me is a big passion. And, genetic testing comes into play there really, really, really well. And they tend to be slightly more receptive because they're looking for ways to rebel, right? Adolescents, grumpy teenagers, etc. And I just help them rebel. My parents eat fast food all the time. Oh, well, let's talk about how you can do something different and still be rebelling against your parents, but now it's actually good for you.
Yeah, and it's true. When we do nutritional consultations, we try and have the parents come in with the teenagers because a lot does come from the parents. And a lot of the, if you will, mistakes can come from the parents, from our era. And they don't understand that a lot of the foods in the food soil, and we could talk hours on the quality of the food soil.
Absolutely.
Just a little factoid, if you will. It appears that in 60 years from now, just heard Mark Hyman say it, that we're not going to have any usable organic soil.
Mhm.
So that poses a problem for our kids. And yeah, I know I'm shaking my
Absolutely.
head also. But,
Yeah.
you mentioned genetic tests and we talked about blood markers. If someone had, since adolescence is a big jam for you, what
Mhm.
would you look for? What would you recommend for the practitioners and the patients out there to have tested for?
Obviously, I'm going to talk about what their family history is or any other, history that they've had so far. But typically, from a fundamental perspective, I always start with nutrition. Do they have a predisposition for a higher need for nutrients? Because we need to lay that groundwork immediately. And also things like gluten sensitivity, celiac, lactose intolerance. Let's clean up the basics first. And then I layer in, especially with adolescents, I layer in detoxification pathway SNPs, hormone pathway SNPs, because they're heading, either they've already hit puberty or they're about to, and we want to head off any negative impacts from that journey before they start or before they get deeply rooted. So those are kind of my basics. And then if they have family history of early onset dementia, or if they're struggling with anxiety that I don't think is hormone regulated, I'll go into more cognitive stuff.
Interesting. So let's get to the big thing. Everybody loves to talk about it, concussions. Lot of concussions with teenagers.
Yeah.
Female athletes, highest incidence of concussion. Soccer
Mhm.
players, to be exact.
Mhm.
So let's talk about a little bit about concussion, what you would look for, you would test for, that kind of stuff.
So concussions, I would obviously run the Dr. Rob concussion panel. You did an amazing job of curating that for Toolbox for us. I would start there, and then phenotypically I would go into serum markers of inflammation, obviously do imaging to ensure there's no additional damage, and pull them, right? Make sure that they have adequate rest. I would also have a conversation with them about how much they love the sport and why they're playing the sport, and is that something that they can be fulfilled doing something different. There's a book that I've been reading my children since they were teeny tiny, the Your Amazing Brain. It's by Dr. Lee, and it talks about the accumulative effects of brain injury. So we would go into what their history was, what would be the risk for brain injury going forward. Obviously, there's a ton of stuff like, progesterone and all sorts of nutrient interventions that you're going to do in that acute phase.
Yeah, it's a great book, Your Amazing Brain. And I think you're right about the brain being the most common thing to talk about. It's a hot topic. And as you all know, the brain gut or the gut brain axis.
Mhm.
So obviously we would talk about gut. Um, how do you like talking about gluten and dairy? I alluded to it with your adolescence.
Yeah, most people at the very least should minimize. I personally feel their gluten and dairy simply because of how it works in your body. Even if you don't have a frank sensitivity, the opioid receptors and just the low level inflammation that it continues. People kick back on that one pretty hard. Although if you work across the generations, it is now it's a hot sexy topic. So as you work with younger patients, they've already heard that. And a lot of them, at least where I'm from, and I'm in the Western United States, so I recognize it's a very, very, very different experience. But a lot of them already are predominantly gluten-free and or dairy-free. However, they're supplementing with those, the gluten-free, but now you're dealing with, it's still a simple carbohydrate, right? It's still rice flour and all of these other things, which now just leads them down a blood sugar spike pathway that doesn't happen to be caused by gluten.
Yeah, you just walked into a great conversation because you would take, they're out of gluten and dairy, but they're eating poor food choices.
Exactly.
So vegan is hot because of the game changer. I don't want to argue all about that. But
Mhm.
unfortunately, a lot of vegans I've noticed, what are they doing? They're eating a lot of,
They're pastitarians, especially. That's the word that I always use with
great
vegans and
word,
vegetarians.
great.
And, coming back into what a lot of our colleagues will talk about, Deanna Minnick, Mark Hyman, it isn't about substituting one thing for another. It's about having a diet that is rich in whole foods, more plants than other types of things,
Mhm.
and trying to get it as well rounded as possible and as organic as you can afford.
I love it. So organic foods,
Yeah.
plant-based, but maybe adding some proteins,
Mhm.
and using serum and genetic testing to individualize it.
Absolutely. Absolutely.
It,
And, obviously modifying with breath testing if you suspect SIBO, or stool testing if they've got GI issues. There's so many options out there.
that's excellent. Yeah, I mean, it's such a conversation piece. Every day I have somebody come in and ask, what do you think about plant-based,
Yeah.
vegan, keto,
Yeah.
intermittent fasting,
Um, yeah.
paleo? So yeah, intermittent fasting. Yeah, I'm a proponent of it. We all know it's really time restrictive eating. How do you
Mhm.
feel about it for adolescents?
It depends on the adolescent. My other specialization is eating disorders. And so with that particular patient population, I tend to be less likely to recommend intermittent fasting with them simply because they already have issues around food and restriction. However, for the greater majority of the population, I think that it's fine if it's done well. And the research behind it is amazing. As far as how well people respond, how well it brings down those phenotypic markers of risk, it really is something that's amazing.
Do you have those windows that you're comfortable with for adolescents versus adults? So I'll give you a standard marker, 14 and 10 to 18 and 6 in
Mhm.
adults. A lot of literature is more 18 and 6, kind of tough 6 hours to eat. What do you do with your adolescents?
It depends on their level of physical activity, frankly. If I have an athlete that I'm working with or someone who's super physically active, I tend to extend their window of eating time unless they're also struggling to maintain a weight or something along those lines. I don't want to send somebody into a ricochet. I don't want them to start breaking down lean muscle. I want to keep them on a good maintenance. So if they're already at a good BMI or waist to hip ratio, depending upon who I'm working with, and they're relatively active, I actually tend to do a 7 to 7 type of a window. You also have to remember that most high schools start at 7 o'clock in the morning, maybe 7:30. So and they don't allow them to eat during class. So if I'm saying, no, you can't eat till 9, that means they're not eating until lunch. And then they go straight into activities after school. And a lot of them don't even get home until 7:30, 8 o'clock at night. And now, even though they had a 6 hour window or an 8 hour window to eat, because of their life, they actually only had like a 3 hour window. And for a growing and developing body, that's just not adequate for a long-term solution.
So how you get them over that? So many of them ask, and my answer a lot of times is, can you bring food with you?
Yeah. And sometimes you can. Sometimes they can. They're allowed to eat in class depending upon what it is. It very much depends on where they are.
Interesting. Yeah, it's school lunch is a whole podcast day in its own, and it's tough, and it's usually not that healthy. And I know your area is different than my area in the Northeast. And like
It's
you
not that
said,
different.
yeah, it's crazy. If you go to the airports in the West or the Pacific Northwest, there's actually organic places
Oh,
in
yeah.
the airport. Because my next book coming out, it's going to be called How to Dine Organically in Airports, because it travels so much. But the Northeast, not as much. I mean, even getting something that's plausibly healthy now is possible. But literally, I can get the organic stuff. So I agree with you that we've got to talk the adolescents. They are our future. I got one more big question for you. What lessons have you learned that you now want to share with health and medical professionals? Something you wish you knew.
There are actually a few things that I wish I had known. In the integrative and functional medicine space, we tend to have these beautiful and amazing protocols because we know so much and we're so excited and we've done so much testing. And they're a good 4 or 5 pages long. And we deliver them to our patients. We explain the why, and the patients leave looking like a deer in the headlights, and they're overwhelmed and they never do anything. And if we're lucky, they come back and we have a chance to rectify that. But if we're not lucky, they never come back. So fundamentally, your most beautiful protocol is only as good as your patient is going to be compliant. So working with your patient to understand what are the changes you actually think you can do, And now let's prioritize that gorgeous protocol to just the top couple of things, and then we'll work through it over time. I think that a lot of practitioners really, really miss the boat there. The other thing that I think happens is people are afraid of silence. And so there's a beautiful thing when a patient sits across from you and they're telling you their history, and they're telling you that this horrible, rheumatoid arthritis developed 10 years ago. And you sit there and you say, it's really interesting. Why do you think that happened? And then you shut up and you let them talk. And practitioners are so used to being the ones who give the information, right? Who fill that silence, who answer those questions, that I think we forget to ask a question and then be quiet and let them answer. And then the last thing, and it's very similar to that, is you don't know the answers to the questions you don't ask. So if you don't ask good questions, or you don't ask questions, you never get the answers that you may need to actually move that patient through their case.
I'm writing everything down. Got my yellow pad here. I don't want people to think I'm disengaging with you. We are communicating. Yeah. I think those are some great takeaways. And, I agree with you on the compliance. I think that another pamphlet we should write is how to be a patient. Come prepared, bring all your lab testing and your history, and be ready to explain what's going on and try and keep it in just stay on the rails. Sometimes people just go off there. I've been to 5 different people. I don't know why I'm here and everything. And that's not what the practitioner needs to hear. The practitioner needs to hear what's appropriate. Mm-hmm. And of course, any kind of case history stuff. Try to fill out the forms in advance, right?
Yes.
Be on time. As in my office, and I know with your practice, we're on time as much as we can. And, fill it out in advance. And, I always say a touchdown, usually two people had to touch the ball, sometimes 3 to score a touchdown. Yes. They got to stop the ball to the quarterback. So he either runs, which isn't typical anymore, he gives it to the running back, he throws it to a wide receiver, which is most typical. So there's a few hands in it. So compliance is critical. I really like to piggyback on that. So before we sign off, what's new? What's next?
What's next? So Toolbox has several additional tests that we're working on. We're currently developing. We're also in the middle of updating and improving our reports to make them hyper specific and to give that bite-sized chunk to practitioners. We recognize that practitioners do their very best to prepare. However, they tend to have a very small window of time to prepare between patients. So we're making sure that our reports give them the most amount of information in the shortest period of time so that they can really, really action their patient.
Absolutely. I love that personalized thing. And I can tell you that genes are here and they're only going to grow more. So everybody gets genes tested. It's a good thing. There's no problem. And like you said, genes aren't your destiny. The environment shoots that proverbial loaded gun.
Yep.
So Dr. Maddux, we need to do this again. It's been great. Thank you so much. Dr. Rob Silverman, Proven Health Alternatives.